Good afternoon. First and foremost, I want to let you know that this meeting is being recorded. Welcome to OMBCD's 2025 Annual Action Plan Public Comment Hearing. Today is July 30th, and you'll be hearing from myself. My name is Kelly Russell, and you'll also be hearing from our program supervisor, AJ Stevens. And we're going to walk you through the draft of how our annual action plan was made, what it contains, and then we're going to turn it over to our friends from Strategy Solutions, Inc., so we can capture your comments and thoughts on the plan. In terms of the draft plan, just so you know, the city has been told we can anticipate funds for 4 federal grants. In order to spend the grant money, we have to develop an annual action plan, which includes community input. The purpose of this meeting is to hear from community members regarding their thoughts on the draft we've created. If you have comments or questions, feel free to speak up, but be aware that we may have to get your contact information to respond at a later time. In terms of the annual action plan, our department oversees 4 federal grants: Community Development Block Grant Funding, which is used to help low to moderate income individuals; Emergency Solutions Grants would help those who are homeless or at risk of being homeless; the Home Investment Partnership Grant, which helps those who are helps low to moderate income individuals with housing; and the Housing Opportunities for Persons with AIDS, which does exactly what the grant says. It helps those who have AIDS and HIV find housing opportunities. These programs can be seen in our draft documents as CDBG, ESG, Home, and HOPA, respectively. The annual action plan is the framework of projects where we expect to spend the money and includes sections on the research that went into making the funding decisions. 3 of the grants, as you will see, are managed by or in conjunction with other organizations. The Emergency Solutions Grant, that's a program we do cooperatively with Allegheny County Department of Housing, Department of Human Services, The Home Program, those funds are given to the Urban Redevelopment Authority, and the Jewish Healthcare Foundation runs the HOP program. CDBG is our largest grant and the main point of the discussion today. Part of the decision-making process in allocating CD funds is included in the creation of the capital budget, which lays out how city departments and authorities will use CDBG funds for major projects and programs. And as you can see through the CD projects, that includes all the capital projects and also the public service grants that come from the city council and the mayor's office. This year, we will also be publishing our next 5-year plan, which sets our spending priorities through 2029. We met with members of the public, representatives from city departments and authorities, and gathered survey responses from across the city. We also consulted data on the housing market, jobs economy, and infrastructure needs. At this time, I'm going to turn the presentation over to AJ. AJ.
Thank you. I just wanted to cover about how we got feedback from the community. This process involves hearing from our residents at every step of the way. So we have been working on this plan essentially since summer 2024. We went to the Mayor's City in the Streets events. We partnered with our Parks Department to talk to people at various events they hold. We did have an official public hearing in October, along with the rest of the capital budget engagement. And we gathered data along with the capital and operating budget teams at the public meetings in the spring. And those were held all over the city in person and virtually. And we had our online survey open from January to May. And we ran a survey for individuals and a survey for organizations. And this was publicized through a variety of channels. We provided paper copies around the city as well. And it was about prioritizing types of services and long-term needs. So the things we learned, the top public service priorities are services for seniors and disabled adults, programs for children and teens, food banks, and homelessness prevention. And then the top community needs were affordable housing, job opportunities, fixing up our streets, curbs, and sidewalks, addressing theft and drug use, increasing public transit frequency, service hours, and connectivity. Y'all are probably familiar with everything that's going on with PRT. We heard a lot about that. The city of Pittsburgh does not control the Regional Transit Authority. We have a close working relationship with them, but all we can end up doing with those that information is passing it along. So then we also heard a lot about decreasing vacancy and improving maintenance of vacant lots. So this is the tentative breakdown of our allocations. These are found in the capital budget, and as you can see, affordable housing is a main priority that we follow, followed by demolishing our vacant buildings through our Department of Permits, Licensing, and Inspections. And then so that was all discussed back in October. And then the main thing that's new in this draft annual action plan is where our public service grant funds are going. So these groups were selected by City Council and the Mayor's Office, and we have 52 nonprofits slated to be funded. So 25 organizations serving about 4,700 children and over 1,000 teens. We've got food banks, some senior programs, job training programs, 3 homelessness prevention projects, and a few, projects providing things like housing counseling, health services, and legal services for survivors of domestic violence. So as you can see, these do sort of line up with those priorities that we heard from the community. Otherwise, our priorities are spending priorities for 2025 to 2029. And basically this means this is where we are trying to steer our spending over the next 5 years. We are looking at prioritizing housing availability and affordability, social and public services, including homelessness, fixing up our community facilities and infrastructure, public safety, and economic development. I'm going to pass it back to Kelly to talk about our timelines.
Thank you, AJ. So it seems like we might be quite way through 2025. Here it is, July 30th, but we have yet to spend any 2025 money because our program year actually begins October 1st of 2025. Also, HUD operates on a reimbursement basis. So money has to be spent first by user groups, and then we get reimbursed by HUD and reimburse you. So in terms of the timeline, we're accepting comments on our plan through Monday, August 4th. The annual action plan has to be submitted by August the 15th. In early fall, the plan will be published. And as I mentioned a few moments ago, October 1st is when we can start spending the money according to the plan. If you have questions or comments, you can always reach us at our email address at community.development@pittsburghpa. Also, if you visit our webpage right there, pittsburghpa.gov, you can view our community development documents. You can see what our public participation documentation involves, and you can find out about any of our grant programs as well. At this time, I'd like to turn the presentation over to our friends from Strategy Solutions, Inc., Janine McQuarrie and Chuck Place.
Well, thank you, and good afternoon. I'm Chuck Place. I'm a consultant with Strategy Solutions Incorporated, and my colleague Janine McQuarrie is with me today. And we'd like to just open up the conversation to the audience to invite some comments. And we have a few questions we'd like to ask, and we really would encourage candid responses so that we can make sure that the city of Pittsburgh is meeting the needs of the community. So our first question today is whether you are happy to see included in the annual action plan. What are the components of the plan that you're happy with? I think that AJ will recognize people by raising your hand. You can do that at the top of your screen. There's an icon, which is a hand next to the smiley face. So to the left of the smiley face, you'll see the raise hand comment or icon rather. And if you'd be kind enough to raise your hand, we'll call upon you and unmute your microphone and let you provide your input.
You can also type in the chat.
Oh, okay. I don't see any hands raised just yet, but please feel free. Again, at the top of the screen, there's a number of icons. One is a human hand next to the smiley face. Just to the left, just click on it and we'll be able to recognize you. Hearing none,
Someone's typing.
oh, okay. Sorry, I did not see that. We do see that somebody is responding through a text message, so we'll give the first thing.
We had a raised hand from Isis Chapman. If you want to go ahead and unmute yourself. Yep, you are allowed to do. Go ahead.
Okay, hi, can you hear me okay?
Yes, we can.
Awesome. So I was very happy to see housing and children and teen programs included in the action plan. And
Great.
those are very appropriately matched with the 5-year priorities, very appropriately matched with the community needs. So thank you very much.
Thank you for that comment. But I think that about 49% of the allocation is geared towards affordable housing.
So we had a question in the chat. To what extent is funding attainable homeownership component of these funds? So attainable
Go ahead.
Attainable homeownership can look a lot of different ways. So you might see it under our home program, which the URA operates. They do a lot of work helping first-time and low-income home buyers get into the homeownership ladder. And you might also see it under one of our public services. We have organizations that provide housing information and referral services, which is basically, you know, the process of buying a house is really long and hard and complicated. And so these organizations find people who want to be homeowners but aren't sure if they can and help them through that. Did that answer your question?
Thank you.
Okay. We have a comment from Allison. Happy to see legal services for domestic violence victims. Would like to see more funding for domestic violence programs such as shelter and mental health.
So Allison, the ESG funds will take care of the shelter funding and domestic violence as well. Mental health could also be handled through public services.
And we have in the past funded mental health programs for domestic violence victims. We have a program for that running right now. But that is a priority that, yeah, we will pass on to our mayor and city council officials who select those projects.
Seeing any of the raised hands? I am seeing someone typing, however. If you see a raised hand that I'm missing, please let us know. Were there any comments about the audience's reaction to what they're happy to see included before we move on to our second question? I'll turn it over to Janine then. We'll conduct the next part of our next question then.
Thank you, Chuck. So the next question we have is, what do you think is missing from the annual action plan? Based on the presentation and everything that you've heard thus far, do you see or think that there is anything missing that will help enhance the lives of the citizens of Pittsburgh, Pennsylvania? So if you have any thoughts on that, would you please either raise your hand or type that information in?
And while people are replying to that, I will read Sarah's comment. PCSI endorses the city's anti-poverty strategy articulated on page 198, which closely matches one of our own programmatic pillars. The city's anti-poverty strategy is based on supporting workforce development, including job training services for low-income residents, and provides supportive services for target income residents. We are looking forward to partnering on these initiatives, which complement so much of the work that we already do. Have the city's 2025 PSG awards been publicly announced? So the awards have not been made official. However, in this document that we are discussing, those are the decisions that we are bringing to HUD. The mayor and city council have selected the groups that they want to fund. We still have to take that to the Department of Housing and Urban Development for official approval. And so we can't promise anyone money until HUD approves it, but the intended awardees are published in this plan, yes.
Seeing any other hands? Janine, did you want to repeat the question maybe for us?
One more time. What do you think is missing from the annual action plan? So based on what was just presented today with the priorities that we discussed, which were housing availability and affordability, social and public services, including addressing homelessness, community facilities and infrastructure, public safety, and economic development. So based on those priorities, what do you think is missing from our annual action plan? If nothing is missing, then we all did an excellent job over these years.
Just in case, I went ahead and put the document in the chat for anyone who has not had a chance to review it. Isis, if you want to go ahead and unmute yourself.
Now, I did come in just a tad bit late and I may have missed, but I did not hear anything about children's programming or after school programming or anything of that nature. Was that not part of the plan?
So it is part of the plan. We have as a priority, sorry, I have too many screens open. We definitely have heard from our public that programs for children and teens are a top public service priority. And so if you look at our public service allocations, our the main chunk of programming is going to benefit those 25 youth organizations serving around 4,700 children. So that's 12 and under. And then over 1,100 teens aged 13 through 19.
Awesome. Thank you very much.
Thank you.
We have any other comments? Or additional questions concerning what do you think is missing from the annual action plan?
That's the final question since you're on a roll.
Thank you, Chuck. So our final question is, do you think that the 5-year priorities match community needs? Do you think the 5-year priorities that we have listed in the action plan match our community needs? And
I went ahead and put them back up on the screen.
excellent.
Thank you.
And they are housing availability and affordability, social and public services, including addressing homelessness, community facilities and infrastructure, public safety, and economic development. And noting in these priorities, we are addressing children and adolescents.
Go ahead, Isis.
I know that you mentioned before that mental health falls under one of these priorities. Did you say that fell under social and public services?
Yes.
Okay, awesome. Well, then to answer the last question, yes, I absolutely do agree that these do correspond with actual community.
Isis, if I can ask you a follow-up question, under the mental health component, are you seeing any mental health conditions that have not been addressed that perhaps more funding should be allocated to?
Absolutely. So we provide services we have 2 programs, one for the children, and then we have one for the parents and the caregivers. So every single year, we see an increase, and I know you all have identified the same thing. After COVID, every single year, we're seeing a ridiculous increase in mental health diagnosis and issues amongst our children. And there's no particular age. Of course, it's higher with teens, but we also see those in middle school age children and with their parents and guardians.
Thank you for that.
Do we have anyone else who'd like to make a comment concerning our 5-year priorities, matching our community needs?
I just needed to say one more thing. I'm sorry, I didn't raise my hand. Is it okay if I speak? This is Isis
Yeah.
Chapman again.
You're very welcome. We appreciate the input.
I just wanted to, I wanted to add this, that I believe that, and I don't want to just keep going back to the mental health, but I believe that the mental health services should be a part of a lot of these issues identified, like for the housing availability and affordability, like it's very difficult for people to focus, particularly single moms, right? Because most of the facilities that we deal with are the single moms are the head of those households, and they're raising several children. So, I mean, that alone by itself indicates that mental health should be a priority along with the housing availability. You see what I mean? Does that make sense?
Yes. Sort of we have to get the mental health components addressed alongside addressing the other structural problems, yeah.
Big point.
Absolutely. Thank you.
Sarah, if you want to go ahead and unmute yourself.
Thank you, and thank you so much for the opportunity to speak. I'm just chiming in to underscore what Isis said. Isis, PCSI would love to partner with you in a way that is helpful, but also at the same time urge the city to think about what weaving in low tech, maybe even low intensity behavioral health supports into the services we provide looks like. I think that there are lots of ways that we can appropriately deputize community-based organizations to provide some valuable services. Of course, nothing can really substitute for trained facilitation and professional clinical support. But to the extent that we can all be involved in supporting folks, it's real hard to retain housing if you're struggling with generalized anxiety disorders. It's real hard to maintain a job if you're prone to frustration and outbursts because you're having a difficult time managing your emotions. And so I think that that's a wonderful perspective, and we'll be happy to help however we can.
Thank you.
Do we have any other questions or comments?
I would encourage everyone to download the document and, keep it available. Perhaps you want to share it with your organizations, your leadership teams and so on, if you haven't done so already. It'd be very helpful for receive input. I also would mention that public comment is accepted through August 4th. And we'll still accept that through email. Is that correct? So if you didn't have a chance today, we certainly will love to hear it.
We'll put that email in the chat. Still seeing a little bit more typing. Also, Sarah, in case you didn't see, Isis put her email in the chat.
One of the nice things about these types of public meetings is the opportunity to network and to meet folks that otherwise you might know a name or an organization, but with changing roles, it's helpful to get to know each other a little bit, because collaboration, as we all know, is the best way to make a strong community.
We've actually had that through the last 2 meetings.
Yeah,
It's worked out well forward.
We all assume that everybody knows each other, but boy, again, changing roles and people leaving, coming into the industry. It's nice to be able to have a chance to do that, even through electronic means and not in person. We still can get that job done and get introduced to each other. So, Janine, did you have any other observations or questions you'd like to prompt the audience based on your experiences here?
Thank you, Chuck. No, just thanking everyone, and as you said, comments are still going to be available to send back to our group, and we encourage everyone to continue to do that. We've been working on this for years, going out into this community, and of course, we would hope that we captured most of the comments that will definitely improve our city, but of course, everybody's opinion counts and opinions change, so we just encourage people to stay engaged as we move through this process.
The question, will the executive orders from the presidential administration affect what grants may be used for in terms of serving LGBTQIA folks and refugees/immigrants?
Yeah.
Go ahead.
All right, so when we did the public service grant applications, what we told everybody is to really not include any type of DEI language in your proposals because we knew this was coming down the pike. And what we have done is a lot of people have really taken that, my words to heed when they submitted their applications and not necessarily focused on specific populations, but talked about populations as a whole. So we must comply with executive orders in order to get this plan executed and approved by HUD. For the groups who so far have been selected, there was no DEI language present. And we just live in a different time right now where if unfortunately that language is present, it's not going to work.
I will add, we have a couple organizations that do work with the LGBTQIA plus community who, you know, they essentially in the project description, you just don't say this is the only group that we are working with. We are working with low income individuals. The refugees and immigrants does get a little bit more complicated due to a very fine tooth comb going over making sure that no undocumented immigrants receive money. However, you know, as long as there is the appropriate paperwork backup, the city of Pittsburgh is still committed to funding these programs as we can in compliance with federal regulations.
Plus, I guess to also build on AJ's point, a lot of these programs, there's income information that must be provided as well for the youth. A lot of people use the school lunch program, and then there's also documentation, depending if you're an adult or things like that, that you have to provide for the program as well. So.
Any other questions or comments before I turn it back over to our folks? I personally wanted to thank the city of Pittsburgh for their excellence in putting together the documents, their procedure. I do some work in some other communities, and Pittsburgh outpaces the other communities that I do work in. So I have to say bravo to the city of Pittsburgh for being very, very open and very encouraging for citizen participation. That's not always the case. So we're very grateful, and I just wanted to pass that to Councilman also. It's challenging, and I always like to say good things when I see best practices, and certainly the city has it here.
Yes. Well, thank you, Chuck, and thank you, Chuck. Thank you, Janine, for being a part of this today. And I want to thank everybody for taking time out of your busy days to just be here with us. We thank you for your input. We thank you for your questions, and most importantly, once again, we thank you for your time. Because without you, this wouldn't be something we could do. So as we get ready to wrap up, once again, you can go to our website. You can still email us. You can community